Well, hello everyone. I'm Councilmember Paul Krekorian, and I want to thank you for joining us again for our latest webinar about dealing with this strange time that we're in with COVID-19. And today we're going to be focusing on mental health, an issue that is probably impacting just about all of us in a year like this that's been unprecedented in so many ways. A year where we have such concerns about our own safety and health and that of our family and friends. A year when there's been so much economic upheaval and uncertainty, and so many of us are concerned about how we're going to make it through these difficult times when jobs have been lost and hours have been cut back, and so many people are facing such financial strain. And then, of course, nationally, we're going through so much in an election year and a time of great social change and upheaval and demands for equity and justice. And all of these things are overlaying one another in a way that many of the things that we used to feel we could plan for or count on have been in many ways turned upside down and disrupted. And that is difficult for all of us. And I'm really pleased to have with me today 3 panelists who can speak to us with a great wealth of knowledge and experience about how people can better deal with these difficult times and how we can confront crisis when it occurs, how we can get through our own challenges and help others as well during these difficult times. So I'd like to take just a moment to introduce our panelists today. Katie Phillips is the San Fernando Valley Community Mental Health Center's Director of Homeless, Reentry, and Substance Abuse Services. Reggie Gallardo is also with the San Fernando Valley Community Mental Health Center. He is the Director of Administrative Services and has been with the center for 23 years. And Christina Giles is a licensed marriage and family therapist, licensed professional clinical counselor, and also certified in trauma-focused cognitive behavioral therapy. So I'm very pleased to have you all here and to welcome you. And I'd like to start with just the biggest overview question of all. And I ask this of all of you. Feel free to chime in. How is this year different in terms of mental health than the things that you've experienced before? I touched upon a couple of issues, but what are you observing about mental health community-wide during the many challenges of 2020?
Well, first of all, thank you for having us on. It's a pleasure to be here and to share some knowledge with everybody watching out there. You know, this year, to put into words, it's been kind of a controlled chaos for us in terms of all the unique situations, not only in the environment we're in with the politics and with COVID, but in the turmoil we're seeing happen with our clients. A lot of them, as you said in my title, I oversee a lot of our homeless continuum, and the unknown in that population being, am I going to get permanent housing? Am I going to get my mental health treatment? Are my providers still going to be able to come out and see me and provide service? Is it safe for them to do so? And so as a center, we're taking every precaution we can to continue as much level of service as we can out in the field, out where the clients are at. It is challenging though, and you have to, worry about staff safety. We have to worry about the client safety and all of this as well. I think we're seeing a lot more depression and isolation. A lot of our participants and clients are just wanting to stay to themselves. They're concerned about engaging in treatment. They're isolating. They're losing support systems because people aren't able to go to AANA meetings like they used to. A lot of our clients don't have access to Zoom or to electronics that they can hop on and do a Zoom meeting. And it's just not the same, it's not the same as that face-to-face interaction that they get with their treatment providers and their supports in the community. it's been very challenging, and we're finding creative ways in trying to bring that back to consumers. It's a day by day, and every day we're presented with new unique situations, and we try to take a team approach and meet the client where they're at to give them the services they need.
Yeah, new and unique situations is kind of the motto of 2020, I think, to be sure. I'm sorry, Christina, were you getting in it?
Said as to our families. Yeah. And the newest thing for our families this year is for challenging is lack of school support. So with our parents and children not being able to go to school, a lot of our parents are lower income, so therefore they're not able to work. And they were working already 2 to 3 jobs. So the biggest challenge for them is they can't take the kids to school. They're isolated in an apartment or a house with even more family now. As we all know, we have multiple families living together now, and there's 3 generations. And there can be 5 people using Wi-Fi at the same time if they're lucky to have it. So for our populations with the children and adults, the biggest issue has been the stress, not just depression, but the anxiety and the overall stress of living in these situations with the kids, and having to do what we see with families is they're trying to do a session on the phone with us while the kids are running around or doing homeschooling. So it's not been an easy year for anybody on their end or ours.
Reggie, did you want to add something?
Yes, I think one of the biggest challenges that we're going on is normally counseling is done face-to-face, and now we have the challenge of doing it remote. And the infrastructure, we had to work on providing the platform so that we can provide the remote services. There's also issues with if there's something acute going on where it really needs someone to be on site. And we really worked through a lot of the services to provide the services throughout this whole pandemic.
So I want to unpack this a little bit, because there's a lot of things, as I said at the outset, that are overlaying one another, and it's producing a lot that is unprecedented. So let's see if we can separate it out a little bit. First of all, as a layperson, it seems to me that with great uncertainty comes anxiety and stress. And I think every one of us, no matter our position in society, no matter our income level, has right now a great deal of anxiety that comes from that uncertainty. So can you talk a little bit about that? Because I think for many people, that feeling is something that they don't feel is shared necessarily by others. They think, oh, it's, I'm feeling too stressed, I should be able to deal with this. So talk a little bit about how widespread that feeling is across society right now, and what are some techniques that people can adopt to deal with that sense of the unknown, the stress that comes from the unknown.
Well, I think it's important that we normalize that stress and anxiety is something that can happen to anybody. And just because you're feeling a little bit stressed and anxious about the current situation, it doesn't bleed into more significant mental health troubles. I think it's important also that we remind each other that these are uncertain, uncharted waters for all of us, and that level of stress is something that we are experiencing. Now, usually we would say, okay, get some support, talk to other people. It's very challenging doing that in the world of COVID, doing it online. I think the anxiety aspect of it is being able to recognize that you're not feeling right. You're not feeling how you normally would feel pre-COVID. There's something new you're experiencing, and maybe that's coming out as trouble sleeping or appetite issues or whatnot. But I want to encourage people to seek out help and to talk to medical professionals, to reach out to those support groups. There is a lot online. I know that our center has launched a self-care webinar that I believe is on our website, and you all might have the link to available. maybe Christina can speak to that, but there's a lot of resources that we have put together as a center to give to people to kind of work through these issues on their own and to know what help and what is available for them in the community.
Yeah, we sent you our link that we can share, and it's open to the community under Moving Lives Forward. And we have links there that I've been part of as to doing self-care trainings. And it's as simple as reminding staff, let alone our clients, to breathe and to get out and walk with your family and take the dog on a walk. And if you're alone, find somebody you can walk with. You can do 6 feet apart with a mask, without a mask, with walking safely. There's all kinds of small things we can do to take care of ourselves and others. So we always go through the laundry list. Are you walking every day? If you're at Zoom doing these meetings every day, are you taking multiple breaks? You know, the research is showing every 50 minutes, we're supposed to be up out of this chair and walking around and stretching. So a lot of times when we do our trainings, it's literally put your arms up in the air. Now let's stretch and breathe at the same time. And are you doing it with your kids? So when we teach, you know, self-care, it's mom, are you doing it with the kids at the same time? Kids, teach it to your mom. Everybody do butterfly kisses. This is a really simple one where you're breathing in and out and in, and we're teaching mindfulness at the same time. And they don't know we're teaching them a whole new technique. And if we can get people to start with one simple breathing, and then we teach this for the schools also, for kids who are too embarrassed to do this, they can't give themselves a hug in front of others. You can do it on your thighs. You know, when you're in regular school, this is how we used to teach it. So we impart all these simple techniques that staff can do. They can role model with their clients. They can do with families. It is simple. It's just a matter we have to do it. And that's part of our role playing and role modeling for everybody in the community as to, we're here to help. Please ask us. We will give you the help you need if you ask.
No, I wanted to piggyback off Christina's suggestion of taking breaks. I think sometimes we need to also take breaks. I know we all want to be informed, but sometimes we need to take breaks from watching, reading, or listening news stories. Sometimes it can be very discouraging. So we really need to make a an effort to take care of yourself.
So I'm really very glad you raised that topic, Reggie, because this has been something that bugs me a lot too. You know, at the very time that we all feel so overwhelmed by things that are going on, we're also probably aggravating the problem by staying glued to social media, the news, hearing these stories kind of reinforcing that stress that we're feeling. And social media in particular seems to be, as it is in so many ways, the thing that amplifies those negative feelings. And so maybe you can talk a little bit about how people might be able to correct that problem, because we're all digitally tied now more than ever because of our virtual life that we're living now. So what are some techniques that people can adopt to maybe relieve that problem?
Well, I'll leave it up to Katie or Christina.
Okay, what we're seeing with the families is twofold, is the parents are becoming addicted to watching news or looking at their Facebook. And at the same time, the kids have become addicted to doing social media for the girls or Fortnite for the boys. So we're seeing research is showing that now that gaming is really out of control with video time. Kids are now staying up. What we're checking with all our associates is the kids are telling them they're up till midnight, 2 a.m., 6 a.m., playing video games because nobody's monitoring them. Either the parents have to work at night in order to survive, or they're doing their own thing and they're not checking in. So what we're suggesting is, as a family, turn it off. Take the phone and turn it off and do some family time, whether you're doing meal time together, teaching kids how to prep, how to cook together. Again, simple things. Having a conversation that's not about how are you doing in school? It's about, oh, what's the weather like to you today? What did your dog do today? Asking other kinds of questions for a change rather than grilling them on school when they're tired of looking at Zoom all day and then they go on and play video. So it's that distracting technique that we teach parents and themselves. Turn off the phone. Go to sleep without looking at the TV. Go to sleep without staring at your phone. All these things that are really important for the brain to sleep at night. So not only teaching parents, but teaching children the same things. That's really important these days.
That's probably good advice at any time, any year, but especially this year. Just staying on kids for a moment. Obviously, their lives have been tremendously disrupted by the change in schooling. And virtual learning, even when it's working effectively, is necessarily missing a lot of the school experience. The social interaction part, just hanging out with your friends during downtime at lunch and so on. The building of relationships. What have you observed about that in the children that you've been talking to or seeing, and what might families do, or what might young people who are watching this do to counteract what they're missing because of virtual learning?
We're seeing a lot. I've seen some reports in the news which have been positive about small family groups getting together, and that they meet out in the lawn or at a park so that they know where each other have been and they feel comfortable, and they wear their masks, and they get 2 or 3 families together, and that way they have still play dates, and they're teaching their young kids how to play with each other without touching. That's been one level. Another level is, I've been hearing about teenagers being very good about, hey, I have a school project I have to do, Mom. Only so-and-so is going to come over. She's going to sit on the other end of the table. I'm going to sit here, and we're going to get this project done. And then they got to do it on Zoom to their teacher. And we were really impressed. It's like, wow, did you share that with the other kids? And the other kids were like, oh, we did it that way, where there was 3 of us and Mom allowed 3. And then I've got neighbors who go to the same school, and they take turns. One kid will go to one house. So at least they're in the same room, separate sides of the table, and they're coming up with ways to share, have some social time. The parents don't have to be as aggravated about watching them. They're motivating each other. And that's been very helpful for parents also in their anxiety as to, one kid's coming over, not the whole classroom, and they're still watching their teacher online, and they're getting their projects done, and their anxiety reduces, and the parents' anxiety reduces because they put something positive in play and it's working. And teachers are coming back and saying, that was really helpful. Let's tell others in the classroom. So that's been very positive. Another way I've seen is that some school counselors, because we have school-based counseling in our center, the school-based counselors will talk to one class at a time and introduce themselves. Hi, I'm here to help. If you ever have any questions, let me know. And the teacher lets them come in for 5 minutes to the class and introduce. And that way parents also hear about, hey, there's school-based counseling. There's ways to ask for help. So I've been hearing a lot of positive things, especially this semester, as more and more parents and children are having to deal with the outcome this semester.
Well, that's great to hear. Good news. One of the benefits of being in school live. There's many, but when we're looking at kids who are in especially difficult situations, maybe in households where that stress is creating a more problematic home environment, I wonder if you, as I've read in the news, if you all are seeing increases in concerns about domestic violence, abusive situations arising, and so on from the time that we're in. Has that been your experience?
Yes, as the program manager over our domestic violence program, we are seeing higher numbers. Our population is specific within the center as to people on CalWorks, which is the Welfare to Work program. But a lot of our other programs are able to help for the adults. It's definitely going up. The problem is it's again underreported. So it's not getting into the news as to accurate numbers because people are again having a hard time leaving. Either they can't leave their home because there's nowhere to go right now.
Right.
The shelters are full because we know shelters are always full at this point. That's another issue. And they go to family that are constantly saying, go back, you can't be here. So yes, we're seeing higher numbers, a lot more trauma. Our children's programs are reporting more numbers of child abuse. So there was a lull, and then August, September started to hit, and we started to see more reports with domestic violence, substance abuse in families. And then the fallout is the kids are being removed by DCFS and they're coming into our programs.
Right, and under normal circumstances, of course, the school would be kind of a place that picks up on that. You know, you'd have teachers and you'd have counselors and you'd have people there who would be observing the warning signs and being able to identify a situation. I imagine it must be harder for school personnel to be able to do that now in a virtual environment.
Yeah, that's why we're trying to touch base with more teachers and principals in the school-based programs, because sometimes the teachers are looking going, okay, I don't see Johnny, or Johnny doesn't quite look well, or Johnny's got a hoodie on and normally he's gregarious. So some of them are picking up on that. And then again, some teachers are so stressed by what they're dealing with that they are not, able to focus in on the kids' needs. They're just trying to get through the teaching and get out themselves because they're overwhelmed. So we're seeing it on both ends.
Katie, how about, maybe you can talk to us a little bit about substance abuse and how that might have been impacted by all that we're going through this year. Are you seeing increases, and are you seeing services being made available for those who are experiencing situations with substance abuse, either themselves abusing or being in a family environment or a domestic relationship with someone who's abusing substances?
Yes, absolutely. And I believe I saw in the news not too long ago that alcohol sales have risen. And with that, not surprisingly, one of the top disorders we're treating in our outpatient drug and alcohol program is alcoholism. And it is very hard to get into the homes of these parents, of families, of adults that need that help at that time. We're getting a lot of referrals through county partners, our outreach teams, and we are making as many attempts as we can to go into the encampments, to go into some of the treatment facilities to help engage and bring people back into treatment. With alcoholism, we've seen a rise in the isolation and just not wanting to engage. Many of our consumers, actually all of our consumers, are low income and barely make ends meet, pre-COVID, and now having lost jobs and having lost that support system, we're seeing it all kind of ties in together. We oversee the adult programs and the parents, and like Christina was referring to, the children and the families. The devastation it's caused to some of these families in terms of the rise of alcohol use, the rise in domestic violence, that's leading into some of our criminal justice programs. We're seeing a lot more people coming in through our criminal justice programs with those types of charges that hadn't had charges before. So we're really trying to do everything we can to, again, provide the education to the community that we are here as an outpatient provider for substance use treatment. And a barrier we've been seeing is getting substance abuse treatment beds, inpatient beds. A lot of inpatient facilities are either losing funding or losing beds due to COVID, and they have to take, lower amount of people. So our clients are waiting longer to get into inpatient beds because of all of these restrictions. So there's quite a few challenges we're facing. We're also seeing a lot of, we're still, working with populations that struggle with heroin and cocaine and methamphetamine. We're still providing treatment and working with them on those issues. We're utilizing a lot of medication-assisted treatment at our facility, and Vivitrol is one of them for alcohol that we're using and tapping into. There's a lot of stigma in getting help for your substance use disorder, as there is for mental health disorder. So we are, part of our treatment is education, normalizing it, getting them in. Unfortunately, there's a long wait for them to get into beds into treatment. So we're trying to, keep them engaged during that time. We have multiple programs that can do that and groups that can do that. Given the COVID situation, it is a little bit harder to run treatment as normal. We have to be very careful with how many people we have in a group and how many people come in, and even their own comfort level. They're not comfortable coming in per se to treatment.
So because much of your work deals with the homeless community, and COVID is obviously having impacts in that community as well, increasing the number of homeless people, first of all, and making it much harder to be able to do outreach. You have people who are not able to be moved because they're sheltering in place. There's a lot of complications that COVID has created with regard to our homeless population. But if someone wants to offer assistance, if someone in the community sees a person who is struggling with a mental health crisis, or a person that they identify as being a homeless person, what resources are available to be able to bring help to that person other than calling the police? Because I know that's been a big concern that people have, that we want to try to not have that be the interaction with somebody who's experiencing a mental health crisis. So what should someone do? What are the alternatives to that?
Well, there's, we service the greater Van Nuys area. That's our prime location for service. So I can speak on that immediate area right there. On our website, Moving Lives Forward, is a phone number for LA HOP. And that is the Los Angeles Housing Services Authority outreach phone number. Anybody in the community can access that phone number and call in somebody that appears to be homeless on the street and get them potentially linked to services. It's a 24-hour phone number. We are not the responding agency, we're the treatment agency, but the responding outreach teams will then respond and put in referrals to treatment if it's necessary and if it's appropriate. So I'm sorry, I don't have that number in front of me. It is on our website. I can get it in a little bit when I'm done here and share that. The second thing is our Homeless Continuum is a drop-in center. So we're open Monday through Friday. We are hoping to extend hours in the future, obviously given COVID, to extend to nights and weekends to cover homeless drop-ins. And so any individual experiencing any level of homelessness, whether they are living on the streets or they're at risk, they have an apartment and due to COVID, they lost their job and they only have a month left of rent and the eminent is there, they can come into us to seek services. And at that point, we can link them up to either employment counseling so that they can get other employment, vocational services. We can try to link them up with some basic needs so that they can, instead of using all of their money on food and resources, they can use that money to cover their rent, and we can assist with some of those other items for them in the interim. And we can link them up to also to mental health and to substance use treatment on site at that center. So that's available. And anybody, like I said, experiencing any level of homelessness or at risk of homelessness can be linked through that program.
Well, and that's so vitally important, because that link to those services for somebody who's on the edge could make the real difference between whether they fall into homelessness or are able to forestall or prevent that from happening and remain in a more stable environment. So it's very important information for people to have. We'll be sure to include that in the comments section of this webinar as well. I want to move now to seniors, because this is also a population, whether housed or unhoused, a population that is especially vulnerable during the time of COVID-19, has a much higher level of fear about the virus itself, and at the same time, this population has experienced the greatest degree of social isolation. Talk, if you can, a little bit about the unique situation facing our seniors and what they might be able to do to help address their mental health concerns as well.
We have a program under Michelle Shepard that is for older adults, and that's 55 and up. And traditionally, the counselors would go into their homes and provide counseling there, and then they would come in once a month, once every 3 months to see the psychiatrist. So, and then access would generally bring them to our door. That's become very difficult because, one, they don't want our counselors coming in. It's not safe for them to go in. So a lot of the work has been done over the phone, and that's very challenging because our seniors were not set up with Wi-Fi and internet service. So a lot of times it has to be, they might have a landline and it's just touching base with them on the landline. Sometimes they're living with other family that won't let them get on the phone. It's been a really hard job for the senior program, and they've been delivering food to their doorstep in order to deal with that. We do have a food bank that Reggie can talk about, and that services clients in the community. So a lot of our programs, especially for the older adult, have delivered food by hand, and that's been helpful. I know a lot of the clients have been very grateful for that part. Anything you want to add to that, Reggie?
Yes, like Christina was saying, we actually have a food bank that gets donations from the grocery stores around the community, and we have been supplying perishables. We actually have a lot of food that we give out to the people that need it.
So this is,
I mean,
this is an
I think
opportunity not only to provide nutritional benefit to the people who need it, but it also gives you an opportunity to have a personal interaction to a degree so that they don't feel as isolated as well.
Exactly. I think with the schools going remote, I know sometimes the children depend on the lunch programs there and trying to offset some of their needs with the food bank and things like that. I believe we also offer meals at our homeless continuum too.
We do. And another thing I want to touch on is the importance of not only our seniors, but our adults and our children and our TAY populations in maintaining that relationship with their psychiatrist and with their nurse. In our clinic, we've been able to, like everybody has talked to, convert over to telehealth psychiatry as well. And so we really encourage those individuals to keep those appointments. Oftentimes, I've heard of cases at our clinics that the staff have gone and put the phone on speakerphone just so the client can have a phone and have some access to talking to their doctor because they didn't have their own phone. Obviously, it's in a confidential environment. But we've tried to get creative so that they maintain that contact and that relationship with the doctor as well. Some of our nursing staff have gone and delivered medications. We've developed a really strong relationship with a couple pharmacies locally that will deliver medications directly to the client's door. So we're also trying to maintain some type of normalcy for them and maintaining that relationship with psychiatrists and nursing staff.
So I want to take a moment before we forget it. If you could if you could each just provide the phone number and website for where people who may be experiencing a mental health need right now can go for help. We'll try to put that up as well, but I'd like for our audience who's listening to be able to hear where can they go if people are feeling that they just need to reach out to somebody, they need that mental health assistance. What are the best places for them to go to seek that help?
I always recommend 211. 211 has our number on speed dial. I get quite a few of those phone calls for the San Fernando area, and then it also goes to our administration and gets farmed out to all of us. But 211 is the easiest for most people to remember. They don't have to memorize our phone number, and they can get any kind of service that way. That's the first step. I think you got more to add, Katie?
I do. On the substance use end, there's a SASH hotline. That's SASH. It's an LA County hotline that, again, is a 24-hour hotline. Anybody struggling with substance use or contemplating their substance use is able to call that line and speak with a counselor and get a referral into either an outpatient, inpatient, whatever level of care they need. It is something that they can talk to. So I believe 211 can also connect you through to that, but that SASH phone number, and again, I can provide that. That's a great resource for anybody struggling with substance use at this time as well.
But I think they can also call administration at 818-901-4830, and we will be able to, like Christina said, we can route them to the correct programs for servicing.
Very good. Give that number one more time, Reggie, please.
It's 818-901-4830.
Thank you. So many of us in local government have been advocating really extensively for more help from our state government and from our federal government for mental health services, because it's clear, it's clear to all of you who are, boots on the ground on this, and it's clear to us as policymakers that there just aren't adequate resources available for folks who are dealing with substance abuse and mental health challenges. And as a society, we need to do so much more. And that's going to take help from the state and federal government. Can you talk a little bit about what you think are the greatest unmet needs in the mental health arena right now?
Well, I can, for me, it's mental health needs and substance use needs. I want to hit on that again, is the lack of substance use treatment beds and the availability. And when we get a patient or somebody coming into our clinic saying, I'm really struggling with my use, I'm ready for treatment, we call, and it's 3, 4, 5 weeks before they can get a bed in an inpatient treatment facility. That's a lot of time lost where that client is ready and engaged to get set into a bed. So the delay in the beds, I just think there's just not enough resources in the Valley for us to utilize.
Yeah.
On the mental health end, I think that, staffing, we need more staffing, and the case ratios we're up against. So, we're running maybe 1 to 22, 1 to 20 client to staff ratio when the clients need more time from us. We need more funding for those types of programs. I also see the forensic continuum, the justice involved continuum, and we have so many people being released from jails right now that are not being released into treatment because there's not those treatment beds available. And when I say treatment, I mean outpatient treatment. So I think there's some funding issues around that under those guidelines that I know that we could use some help in, and that is a barrier that we've experienced. And the housing crisis, I think, the homeless crisis and rent being so high and the lack of permanent supportive housing, these are all things we're working on. Our center does a really excellent job at getting clients linked to vouchers and housing them. I think we have about 36 in the queue right now that are on the brink of getting their very first apartment, which is wonderful. But again, they're not local. They're out in outskirts of the area. And so we're moving them away from supports, and that's a challenge. So we could use some help with that.
And to tag on to the homeless situation, we deal with families. And there are not enough beds, there are not enough motels, there are not enough shelters, domestic violence, or for families that we see. So, that's another crisis that's going to be getting worse due to this year. It was already bad for the homeless situation, but it's only going to get worse after COVID, even as things hopefully get better next year. The homeless situation is not going to improve for a while. That's a major issue.
Well, and those not having those options, particularly when it comes to substance abuse, but also the other areas as well. Just having domestic violence shelter capacity, having bridge housing, having permanent supportive housing. When we don't have enough stock in those areas, the problem becomes incrementally worse because people can't stabilize their circumstance. And if somebody is even in a bridge housing facility, they have an opportunity to breathe, to stabilize their situation, to perhaps work on their substance abuse issue, or get the counseling they need, or get a job so that they can stabilize their economic situation. All of those things are only made possible if we invest in the infrastructure that's necessary to help them stabilize their situation. I'm pleased that we're doing that aggressively in my district and across the city. Hopefully that will be a lifeline for many of those people who will have an opportunity to break that cycle of homelessness once and for all. I want to just finish as we're wrapping up here on, this may be a hard question, forgive me if it is, but I always like to finish with a bit of an optimistic note, and I think people have been looking to government to deal with all of these issues. And maybe people lose sight of the fact that all of the things that we've talked about are societal issues. Government has a role certainly in resolving many of them and helping people, but we can also help each other an awful lot too, just as human beings. So if you can, talk a little bit about, as a community, as an individual, what can each of us do that will help lift up our neighbors? What can we do to help raise the level of mental health in our community and our society as individuals? Anybody have any thoughts or suggestions that you'd like to offer to the viewers?
I always suggest start simple with what you're comfortable with. If that's get involved with your children's school, if you can volunteer there, if you volunteer through your church or temple, something local, and that always makes us feel better about ourselves if we give to others. So that's the basic way to start. And then if you want to get bigger, then you go into politics, or you become a teacher, or you become a counselor like us. But always start where you're comfortable. You don't have to do too much.
And if there's an interest of getting involved with our center, we're coming into the holiday time, which is another anxiety-producing time for a lot of our participants and our families. Right now, we're getting started to do a huge toy drive so that every child consumer we see can get a toy. So if you're able to donate a few toys for us to wrap and to provide to our family and our children, that will make a huge difference for them. We're doing food drives as well. So we do a lot of I guess, supply drives ourselves to get going so that we can get these supplies to the consumers we need. So we're always looking for assistance with that if there's any interest to get involved.
Terrific.
There. One of the things I wanted, and I would ask Reggie to speak on this, is the mental health first aid that we offer as a center. And maybe you can speak on that, Reggie, about how that can help.
Yes. Thank you, Katie, for reminding me. We got a grant from Dignity Health to provide outreach, and in particular, providing training for mental health first aid in both adult and youth. It's a national program that really tells you how to, not for you to become a therapist or diagnose, but for you to be a first aider, where you really learn how to look at behaviors, and then those that are very concerning, and then get appropriate professional help, and also how to like respond to emergency situations. So I highly recommend, and it's free to the anybody in the San Fernando Valley to take this training. And we have, besides our center, there's multiple program agencies that are also doing mental health first aid. So I'd like to make a recommendation that you contact the program or our administration if you're interested in the training.
And that information is available on your website?
I believe it is.
Can we, if we have the link, can we bring up the website, or is that not available?
Yeah,
right now?
it's movinglivesforward.org.
Very good. movinglivesforward.org. Well, and then I guess the one last thing I would say is that each of us can help a neighbor just by reaching out, just by staying in touch, just by talking. My staff and I regularly call the seniors in my district just at random in order to just check in on them and see how they're doing. And sometimes just a phone call can make a world of difference to somebody who feels isolated or anxious or afraid. And each of us can make a difference in lifting up someone's life and lifting up our community by doing that. So I would just encourage everybody to look out for one another and take care of each other. And I want to thank my panelists today. This has been really a very enlightening discussion. So I want to thank Katie Phillips, Reggie Gallardo, and Christina Giles. Thank you very much for being with us, and thank you for the work that you do every day to transform lives. I'm Paul Krekorian. I'm so glad that you were able to join us for this webinar on mental health resources. We will have the phone numbers and websites that were discussed today available on my website. Thank you very much for joining us today. Take care of each other and stay well. Thank you very much.